Antimicrobial Resistance (AMR), a rising global threat number 1179, December 7, 2024. A report titled AMR Could Surpass Cancer as Leading Cause of Death by 2050, published by Medscape Medical News on December 2, 2024, highlights the growing concern over antimicrobial resistance (AMR). A MR occurs when germs such as bacteria, viruses, fungi, and parasites evolve to resist the effects of medications designed to eliminate them, including antibiotics, antivirals, and antifungals. This resistance makes infections harder to treat and increases the risk of disease spread, severe illness, and death. Consequences of AMR: reduced treatment effectiveness for common infections such as pneumonia, tuberculosis (TB), and urinary tract infections (UTIs. Increased healthcare costs due to prolonged hospital stays and more intensive treatments. Higher mortality rates as some infections become untreatable. Challenges for surgical procedures and cancer treatments, which rely on effective antimicrobials to prevent infections. The growing public health concern without intervention. This AMR death number could rise to 10 million deaths annually by 2050, surpassing cancer as a leading cause of death. In 2021, 4.71 million deaths globally were associated with drug-resistant infections, with 1.14 million deaths directly attributed to AMR. Deaths directly caused by AMR in individuals aged 70 and older increased by 90% from 1990 to 2021. Three primary reasons for the rise of AMR. 1. Misuse and overuse of antibiotics. Antibiotics are frequently overprescribed, often unnecessarily for viral infections where they are ineffective. Self-medication and failure to complete prescribed antibiotic courses also contribute to resistance. 2. Antibiotic use in animal agriculture and environmental pollution. Antibiotics are used in animal farming for growth promotion and disease prevention, leading to the emergence of resistant bacteria that can transfer to humans through the food chain or environmental exposure. 3. Globalization and increased international travel. Global travel facilitates the rapid spread of resistant germs across regions and borders. The author's research findings. The author conducted a study to analyze two global AMR death rates, direct versus associated from 2000 to 2023 under the influence of three aforementioned inputs. This unique math, physical, and engineering-based analytical approach offers a novel way to address biomedical challenges. This study calculated the strength of interactions or the degree of connections between AMR death rates and each input variable to evaluate the progression of global AMR death rates. While this model provides only a partial perspective on this complex issue, it allows for the observation of global trends through a focused lens, offering valuable insights into the dynamics of rising AMR death rates. This energy analysis results. This paper covered results from two cases: Case 1, which uses the direct usage approach, and Case 2, which applies the associated absorption approach. Summary of findings. 1. Correlations are between output and inputs. Case 1 97%, 97%, 40%. Case 2 98%, 99%, 25%. This suggests that international travel has a limited relationship with and influence on the issue of antimicrobial resistance (AMR). 2. Total energy values. Case 1 1.62, Case 2 14.93. The ratio between Case 2 and Case 1 is 9.2, driven by the higher average AMR tonnage from associated absorption compared to direct usage. This energy analysis results. This makes sense, as the direct antibiotics tonnage comparison is 4.024.14 divided by 1.03. The fourfold higher tonnage of antibiotics absorbed through the body's internal processes results in a ninefold increase in VMT energy, a clear amplification effect. 3. Energy contribution ratios. Case 1 90.6%, 6.6%, 2.8%. Case 2 90.6%, 6.6%, 2.9%. Both cases demonstrate identical energy contribution ratios. Direct antibiotic usage contributes the most, accounting for 91%, followed by antibiotics used in animal agriculture and environmental pollution at 7%, with global travel contributing the least at 3%. 4. COVID impact on total energy diagrams in time zone during the COVID-19 period from 2020 to 2023. Although COVID-19 complications may have increased the need for antibiotics, the large number of patient deaths may have resulted in a net reduction in total AMR cases. However, this statement requires careful consideration and could be misleading. While deaths may reduce the absolute number of individuals with AMR antimicrobial resistance, this does not necessarily imply a direct reduction in AMR prevalence, particularly if antibiotic usage increased during the same period. Additionally, bacterial co-infections often occur with viral illnesses, but this pattern might not apply universally to all contexts. Interestingly, in the cumulative energy diagram, there was a rapid increase during the pre-COVID period from 2017 to 2019, which then plateaued during the COVID-19 years. Key message: antibiotic medicines are undoubtedly highly effective in treating infections. However, their misuse or overuse by healthcare professionals and patients' demands can lead to the development of antimicrobial resistance (AMR). Recent reports have issued warnings that AMR could surpass cancer as the leading cause of death globally by 2050. In this study, the author utilized two antibiotics usage models, direct usage versus associated usage, under three selected influential inputs over the past 24 years, from 2000 to 2023, to quantitatively analyze the impact on these two AMR situations. These two analytical models focused on three identical inputs: direct antibiotic usage, indirect usage association through animal agriculture with polluted environment, and influences from international travel. Even when the normalization factor for animal agriculture usage was amplified from 0.1% to 10%, the results still demonstrated that the direct usage of antibiotics contributes 91% among these three inputs has the most significant impact on patient health regarding AMR. This article applies the math-physical medicine research methodology to explore the complex, biomedical issue of antibiotics usage and its implications on global health. The key takeaway from this study is that while antibiotics are an effective treatment for infections, we must remain vigilant about overuse, the aging effectiveness of antibiotics, and indirect infection pathways through animal-based foods and polluted environments. What individual patient can do: use antibiotics only when prescribed by a healthcare professional. Complete the full course of treatment even if symptoms improve. Practice good hygiene to prevent infections.